Has it ever happened to you where you started losing patients and not knowing what was going on with them? Ultimately, you found out that the physician is starting to recommend your patients to other agencies. When this happens, you need to go into what they call an offensive mode. The first thing you need to do is make sure you meet with that physician and you find out what's going on and how you can improve yourself. Don't go into an attack form and start attacking the physician, because the last thing that you want to be able to be doing. Remember, you need those physicians to be able to refer patients to you. Most of the time, you will find out that maybe one of your staff members was just not doing what they're supposed to be doing for your patients, and your physician got mad. Maybe the physician found out that you're not doing a good job, right? What you need to do is you need to be open to what we call constructive criticisms, okay? Sometimes these physicians are actually taking their patients to another agency because those agencies can provide better care. So, what you want to do is you want to be able to find out what is causing those patients to be transferred to other agencies. Sometimes the first step is to be political, is to be able to ask questions and to figure out what you need to do, what your team needs to do to better yourself in order to better your services and gain the trust of those physicians again, because you lost it. Now, let's say, for example, you found out from previous patients of yours that when they got admitted to a hospital, they were being coerced or told by the hospitalist or the discharge planner in those hospitals to start using a different agency. Now, the first thing you need to ask is this: was the hospital aware that you guys actually exist, that you guys actually used to take care of the patients? And if did the patient give your information to the hospital? If that's the case, what you need to do is you need to be speaking to the hospital. You need to go to them and you need to say, "Hey, what's going on? Why are you sending them? Is there a preference?" And sometimes these hospitals are going to say something like, "Well, this is our sister agency." And when that happens, you know, in the end, it's still the patient's choice. What you can do is you can just reach out to the patient and say, "Hey, just to let you know, that's your sister home health, but at the very same time is it's still your choice. But at the very same time is you have to make the decision. We cannot be aggressive." And sometimes these patients are gonna say, "No, but I like Michael as my nurse, or I like Jen as my nurse. I want to keep you guys." Then we tell them, "Well, make sure you tell them that that's what you want, or have your POA or your family member let them know, because it is gonna happen sometimes." And then of course you know how it is. Some of these social workers or discharge planners, they already have their preferred agency to be able to send their patients to. So the main goal is then to, at least you were able to have a meet and greet with this particular potential referral source, and hopefully try to make a deal with them and try to find out, hey, let me tell you about our services. This is when you go into what you call your full court press marketing mode, right? You're there already. So they don't know you yet. So maybe your job is to let them first know you, then like you, then trust you. So you might lose this particular patient, but at the very same time as you gained an opportunity to be able to meet a new referral source. More than likely, you probably were not in that hospital, but now you are sitting face to face with this person, and now it's about the beginning of the conversation and of asking, what made you choose to work with other agencies in the past? If there are 3 things that those agencies are currently doing that they can improve on to provide better care for you and your patients, what would that be? Start asking the right questions, start marketing, get their information, and follow up with them. Always remember that everything that you're going to do, most of your marketing strategies are going to be benefiting from your follow up system. Like, you can have a great initial presentation, a first initial meet and greet, but your admissions are rarely going to be coming just from that initial meeting. It's most of the time going to be coming up from creating accounts through the process of follow up, right? To creating rapport and trust, and that they want to work with you guys. So, what are you guys doing right now that's going to help you guys strategize this whole problem of losing patients? Some of you guys actually are just wondering, where am I going to get the next patient? And then some of you guys at the same time is, I got some patients, but I can't lose 1 or 2 to another agency because it's going to ruin me. So you need to know how to keep those patients. It's easy to open up an agency. And some people are going to say it's hard. Yes, it may take a little bit longer, but it's a lot harder to keep your doors open. So you want to minimize the loss, right? That's why large companies, they spend a lot of money in security, because a lot of companies lose money because people are stealing things from them, their own employees. So what you need to do is you need to be able to understand that you need to increase patient coming in, and you need to also decrease the chance of patient being lost, either to other agencies or being unhealthy and then back in the hospital or passing away. That's the goal of your agency. Always understand that home health marketing is always going to be easy as long as you know what you're doing. And that's our goal here at Home Health Success Academy. Don't forget to click the subscribe button and the bell button to be notified of any new videos. This is Michael. Take care.